Thrombosis is one of the most insidious and hidden threats to modern human health. Despite the absence of pronounced symptoms in the early stages, blood clots forming in blood vessels can break off at any moment and cause life-threatening conditions: stroke, myocardial infarction, or pulmonary embolism. According to the World Health Organization, cardiovascular diseases, including thrombosis, claim millions of lives worldwide each year, remaining the leading cause of death. Many mistakenly believe that protection against blood clots is possible only with the help of medications, anticoagulants, and antiplatelet agents. However, scientific research is increasingly confirming that nutrition plays an equally important, and sometimes even a key role in the prevention of thrombosis. A well-chosen diet can gently but effectively reduce blood clotting, improve blood flow, and prevent platelet aggregation, the process underlying blood clots. Among the many healthy foods, 3 natural allies of vascular health stand out: kiwi, almonds, and turmeric. Let's start with kiwi, a delicate, sweet, and sour fruit that is often underestimated. In fact, kiwi is a real storehouse of useful substances, vitamin C. It contains even more of it than citrus fruits: potassium, fiber, and unique enzymes such as actinidine. But it is especially valuable in the context of thrombosis prevention. Studies conducted in Norway and New Zealand have shown that regular consumption of 2 kiwis a day for a month reduces the risk of thrombosis by 20 to 28%. The effect is comparable to taking low-dose aspirin, but without the characteristic side effects on the gastric mucosa. Kiwi improves the rheological properties of blood. It makes it less viscous, reduces the level of fibrinogen, and strengthens the vascular endothelium, protecting them from damage and inflammation. The second powerful natural protector is almonds. This nut holds the record for vitamin E, also called tocopherol, which is honestly one of the most powerful fat-soluble antioxidants out there. Vitamin E not only slows down the aging process of cells, but also prevents the oxidation of low-density lipoproteins, what we usually call bad cholesterol. This, in turn, reduces the risk of atherosclerosis, which is actually one of the main predisposing factors of thrombosis. In addition, vitamin E suppresses platelet aggregation, so it helps reduce the tendency of blood to form clots. Just about 55 grams of almonds, which is roughly a handful per day, can cover the daily requirement of an adult for vitamin E. Almonds are also rich in magnesium, a trace element that relaxes vascular smooth muscles, helps normalize blood pressure, and improves heart function. The monounsaturated fats in almonds also contribute to lowering LDL levels and increasing good cholesterol, or HDL, which creates a much more favorable lipid profile. However, turmeric, a spice known in ancient Ayurvedic medicine, is considered to be the real star of the anticoagulant diet. Its active ingredient, curcumin, has a powerful anti-inflammatory, antioxidant, and antiplatelet effect. Modern studies confirm that 1 teaspoon, which is about 7 grams, of turmeric per day can reduce the tendency of platelets to stick together by 15 to 20%. Curcumin inhibits the production of thromboxane A2, a substance that causes vasoconstriction and platelet activation. In addition, it inhibits the activity of blood clotting factor and reduces the level of C-reactive protein, which is a marker of systemic inflammation that's closely associated with the risk of thrombosis. But it's really important to remember that curcumin is poorly absorbed in its pure form. To increase its bioavailability, it's recommended to use it together with black pepper, since piperine enhances absorption by 20 times, and a small amount of fat. For example, you could add it to warm milk with honey, which is sometimes called golden milk, or you could season salads with olive oil, a pinch of turmeric, and a little black pepper. It is important to emphasize that these products are not a substitute for drug therapy for already diagnosed thrombosis, thrombophilia, or a high risk of thrombosis. However, they are honestly some of the most powerful means of primary prevention for healthy people, as well as for those who are at risk, like people with varicose veins, after surgery, with physical inactivity, in the elderly, or with a hereditary predisposition. They're especially effective when combined with other principles of a healthy lifestyle. Getting enough water, since dehydration increases blood viscosity, regular physical activity, even simple walking can improve microcirculation, quitting smoking, and keeping blood pressure under control. However, there are some caveats. People taking anticoagulants, like warfarin or rivaroxaban, or antiplatelet agents, such as aspirin or clopidogrel, should definitely coordinate the inclusion of these products in their diet with their doctor. The combined effect can lead to excessive blood thinning and an increased risk of bleeding. It's also not recommended to overdo turmeric if you have an exacerbation of peptic ulcer of the stomach or duodenum, or if you have cholelithiasis, since the spice can provoke an attack. Nevertheless, including kiwi, almonds, and turmeric in your daily menu is a simple, tasty, affordable, and scientifically proven way to take care of your vascular health from the inside. This isn't a magic pill, but it's a reasonable, informed approach to prevention. After all, the best treatment is the one that isn't required. And when prevention becomes a part of everyday life and actually brings you pleasure, you'll want to do it not just from time to time, but every single day.